Hi, Ms. Stock. Thank you for coming to speak to us. I need to ask you a couple of questions while my colleagues stabilize your daughter. I'm Dr. Odinson. Are you able to talk to us briefly?
Yes, yes, doctor.
Okay. I understand you said your daughter lost consciousness or fell. Something. Can you describe what happened?
Yeah, she just fell on the ground, just out of nowhere.
All right, all right. And I believe she's pregnant. How far pregnant is she? Do you know?
Yes, she's 32 weeks.
Okay, okay. And how old is she?
She's 17.
Okay. And tell me, do you know what happened when she fell down? Did she shake at all?
Yeah, her arms shook, um, and
Like
yeah,
her whole body was shaking.
mainly her arms were shaking.
Okay. And you said she lost consciousness.
Yeah, yes, she did.
Um, and during this time, did she bite her tongue or wet herself?
She didn't bite her tongue, but she did wet herself. Yes.
Okay. And did she come to afterwards?
Sort of. She woke up, but she's confused. She didn't
Okay,
know
so
where
she
she
doesn't
was.
remember what happened.
No,
Doesn't remember what happened. All right. Has anything like this ever happened before? She had a fit before? No
no,
history of epilepsy or anything?
no, this is the
Right.
first time.
Any recent illness or preceding illness that you might have,
No, nothing.
how's her health been throughout the
No,
pregnancy?
she's always been very healthy and she's
Okay.
had a normal, healthy pregnancy.
All right. I have to ask, does she have any history of drug or alcohol use in the past?
I, I don't think so. I don't think she's ever used any drugs. And maybe she drinks like every now and again, but only for like somebody's
Okay.
birthday party. Not a lot.
Okay. And all right. And tell me, any history of any head trauma? Was she ever in an accident where she hit her head
No,
or fell or anything before? All right. Ah, thank you. I've got her what she got there from her folder. I see. Yes, she has about 32 weeks. She did book here in the first trimester. They took bloods. Those look normal. She had an ultrasound. Uh, there's no medication mentioned. Does she take any medication for anything?
the iron and folate that the hospital gave her.
Okay. All right. And tell me any history of high blood pressure that she's ever had.
Never.
And did she ever mention that they might have found that she had high blood pressure during this pregnancy or anything?
No, nothing.
All right. I know there's a lot of questions right now. Do you possibly know if she was complaining of any abdominal pain before any of this happened?
No, not that I know of.
Did she mention anything about the baby's movements being more or less or having stopped?
Um, I think she said that the baby was moving, but I can't remember.
Okay. And then probably wouldn't have known, but she didn't mention anything that she was bleeding at all? Any vaginal bleeding?
No, not that I know of.
All right. Thank you very much. Uh, just try and take a few deep breaths. We're going to try and sort your daughter out as best we can. You've been very helpful. Thank you so
Thank you,
much.
doctor. Thank you very much.